Ebola, global travel, and the challenge of how to contain this deadly disease. We let the science speak for itself. Also, does the greatest hope in the fight against Ebola rest with a Canadian vaccine? I'm Affan Chowdhry. Welcome to Globe Now. There's a lot of anxiety around Ebola, especially as the global death toll climbs. In fact, this morning, a Nebraska hospital announced the death of Dr. Martin Salia, who had been in Sierra Leone, helping contain and treat the outbreak there. Dr. Salia is now the second person to die from Ebola in the United States. Globally, it is believed that Ebola has killed at least 5,177 people. And while there has been no confirmed cases in Canada, there is a lot of anxiety and questions. We're going to answer two such questions posed by readers as part of the Globe and Mail's Canada Q&A project. Joining us is Dr. Richard Lester, who is part of the Neglected Global Diseases Initiative at the University of British Columbia. Dr. Lester, let's address some of that concern and fear. This is one of our reader questions. Here's the first one. Why haven't we either stopped all air travel from West Africa or imposed a mandatory quarantine on arrival to Canada yet? Let's deal with the first part. Stopping all air travel from West Africa. What do you think?
Sure. So first of all, we don't have direct flights from West Africa into Canada, so they would be indirect flights, and that's more complicated to manage. The other is that we know that that's not likely to be effective. The chance again of somebody coming into Canada within that window period is extremely small, and we know from previous global outbreaks such as SARS that mandatory stopping flights and stopping air travel is difficult. There's many ways around it, but not only that, it's not very effective, and it has other devastating effects on the economy and even the health. The economy is related to the health of the population, so there's some risk of doing more harm than good. In a global economy, it's really difficult to just stop air travel and intercountry travel.
Okay, the second part of the question is about a mandatory quarantine on arrival to Canada from Ebola-affected countries. Would that make Canadians safer?
No, I think the consensus is that would not make them safer. I think what is reasonable and what some of the pushback from the provinces has been actually on the Quarantine Act is to allow a case-by-case basis. So quarantine of somebody who's sick is actually is quite reasonable, because when somebody's sick with Ebola, the chance of transmitting it is quite significant. When somebody's not sick, that is extremely remote, and instead close monitoring and evaluation is effective. It's been shown to be effective, and the current recommendations actually are that it's mandatory to check in with public health locally, and that they will do follow-up on a case-by-case basis and monitoring.
Here's another question from a different reader about the countries helping in the fight against Ebola. I wonder how many countries are providing significant support to Ebola victims in Africa. We only hear of Canada, the United States, and the United Kingdom. What are some of those other countries?
So interesting question, and many countries have stepped up, and I think that's often the case. Is we first of all, we pay most attention to either our own country or some of the usual big donors, but a number of countries have stepped up. Most importantly are the countries that are affected themselves. Now, those health workers have taken the greatest risk and the greatest hit. It's extremely stretched, and they're making huge commitments on an ongoing basis, and the neighboring countries as well. In terms of the Western countries, Canada has contributed, Australia, the US, but there's actually a number of other countries. Cuba sent a number of health workers. They have excellent trained doctors and other health workers. They've made a commitment, and pledges in terms of funds. Countries like China, Azerbaijan, Ireland, Malta, a number of countries that we may not have expected have all stepped up to the plate with some funding towards the effort.
Interesting. Thank you so much, Dr. Lester.
Thank you.
Well, we want to hear from you. If you've got more questions about Ebola, be sure to submit them to our Canada Q&A campaign. All you need to do is hop onto Twitter and include the hashtag #AskTheGlobe. Now, there is some hope in the medical battle against Ebola. There is an experimental vaccine that could one day protect people from Ebola disease. And on Friday, health officials announced the first trial that will be taking place in Halifax. Here's the story of the Canadian Ebola vaccine and its journey from the lab and quite possibly one day soon to the field.
The Canadian vaccine is known as VSV-EBOV, or VSV-ZBOV. The VSV part stands for vesicular stomatitis virus, and that's a virus that's common in animals like livestock, but it's harmless to humans. So what the scientists who created this vaccine have done is genetically modify this virus so that it expresses a protein that you would find in the Ebola virus. And the idea is that when you inject this vaccine into people, that it will force the body to mount an immune response, so that if the person ever did come in contact with the actual Ebola virus, they would be protected. As well, it looks like the vaccine can hopefully be delivered in just one dose, which if you're going to be distributing it widely in Africa would make a huge difference, because it's obviously a lot harder if you have to give somebody a primer shot and then track them down at some future date to give them a booster. So the Canadian vaccine was developed largely at a place called the National Microbiology Lab in Winnipeg. This is Canada's only lab that has what's called a biosafety level 4 containment lab. So that's sort of the highest level of protection you can have in a lab. Until the outbreak began, the testing that had been done on the vaccine was limited to animals, and it had shown good results in those tests. But as of last month, some actual phase 1 human safety testing began on the vaccine. The purpose of those human safety trials is to make sure that the vaccine isn't toxic. Basically what the World Health Organization has said is that they're expecting results of the phase 1 safety trials by about the end of the year, and then they can decide whether they want to expand them for use in what would probably be phase 2 safety trials in West Africa, where the outbreak is actually going on. And they would be used primarily on healthcare workers at first who volunteered and who understood what they were signing up for.
That's all for today's show. Remember, you can send us your questions about anything you saw on today's show, or if you want to send a question that we can help answer or investigate, ask the Globe. I'm Affan Chowdhry. Thanks for watching.